Hi everyone, I'm Brian Taylor and welcome to Healthy Perspectives from St. John River District Hospital. Today the cold and flu season is about here. So today we're going to talk about the cold and flu season with one of our health experts from St. John River District Hospital, Dr. Suzanne Ross, a family medicine expert. And Dr. Ross, as I mentioned, the cold and flu season is upon us. Tell us what we have to look forward to.
Well, you're right. It is upon us. The actual flu season runs from about October until May, so we're right at the beginning of it now. I haven't seen any actual cases of flu in clinic yet, but certainly they could start coming any time yet.
Now tell me, there's obviously a difference between the cold and the flu.
That's right.
Tell people what the difference is, and how do you know if you have the cold or if you have the flu?
Right. Well, sometimes it can be very difficult to tell the difference between the two. They can have very similar symptoms like sore throat and cough, fever. Generally with the flu, it will come on suddenly, hit you all of a sudden, the typical feel like I got hit by a truck. You'll generally have a higher fever, feel just really out of it for a few days, sore throat, headaches, things like that. But obviously that can be very similar to a cold. So sometimes it's really hard to tell. As a physician, we can do a nasal swab to tell the difference if this is actually the flu, and sometimes we have to do that.
Now, at what point, if someone at home, you think you have a cold, you think you may have the flu, when does someone come to you?
Yeah, that's a good question. So in either situation with the cold or the flu, not everyone needs to be treated, even if they do have the flu. So somebody who's otherwise healthy and, tolerating their symptoms okay with acetaminophen or ibuprofen, they can stay at home and try to ride it out. But anyone who has underlying chronic conditions like asthma or lung disease, diabetes, they really should see their doctor right away.
That's not the time, though, that they're going to get an antibiotic, is it?
Absolutely not, no. So like I said, the first step would be to verify that it's the flu, and we can do that with a nasal swab. We do have a few antivirals that can work against the flu. And like I said, not everyone needs to be treated, but the doctors can use some guidelines from the CDC actually to determine who should be treated with the antivirals.
Okay, we're going to take a quick break now, and when we come back, we're going to talk about the flu vaccine and about some of the myths around colds and flus. Thanks for watching Healthy Perspectives from St. John River District Hospital. We'll be right back. And welcome back to Healthy Perspectives from St. John River District Hospital. Today we're talking cold and flu with Dr. Suzanne Ross from St. John River District Hospital. And Dr. Ross, let's get to the flu vaccine. It's shots, there are nasal forms of the vaccine. Tell us a little bit about what's available to people and how important it is that they get this vaccine.
Right. It's actually gotten quite a bit more complicated this year. There are several different flu vaccinations available. As you mentioned, there's the standard flu shot. There's now a high-dose flu shot that's indicated for people over age 65. So it gives them a little higher dose so that their immune systems can hopefully respond to it better. There is a flu shot available that can be given to people with egg allergies. That's called the recombinant influenza vaccination. This year there's also a quadrivalent vaccination. So the typical flu shots are trivalent, meaning they cover 3 different forms of the flu virus. But this year there's also this quadrivalent one, which covers an extra version of the flu. And then, like you said, there is the nasal spray. The nasal spray is is only for healthy people up to age 49. So it's not not indicated for everyone, but for some people that's a better option than the shot.
Now, how do you know as a patient what to ask your doctor for? And how does the doctor know exactly what to give you?
Right. So again, we follow guidelines from the CDC. Fortunately, they have some very good guidelines that we can use. And because it is so complicated, it can be hard to know which one is right for you. So you should really talk with your doctor about it. Anyone over age 65 should certainly get the high dose flu shot that will protect them better from influenza. And then depending on age and other medical problems, they may either get the intranasal one or the regular shot.
Now, in terms of the flu, we'll get to and colds too. Who is more at risk? Are they young people, very young people, and very old people?
Right.
Or who is it?
Right. So certainly very young people. Babies under 6 months old cannot get the flu shot, so they are at the highest risk of getting complications from the flu. So certainly anyone around them, their caregivers, their family members should be vaccinated. And then similarly, older folks, their immune systems start to wane with age and with other chronic conditions. So those people, as well as their caregivers and those around them, should certainly get vaccinated. The CDC recommends that everyone over age 6 months get vaccinated. But it's most important for those people taking care of the sick or the young or the old, and for people with other chronic conditions to get it.
Now, back to the people, the shot now that's available for people with egg allergies. Previously, people who have those allergies were kind of left out there on an island without the vaccine. How have we got to this point, and are there people still with egg allergies that need to be careful?
Certainly. It depends on what the allergy is. So if people, some people will test positive on blood tests when they get allergy testing. They say, oh, you have an allergy to eggs, but they still eat eggs. They can get the regular old flu shot. They don't need to worry about it. It's really the people, and anyone who just gets hives with eggs, they can still get a regular flu shot. It's really the people who have real severe allergic reactions to eggs or chicken. They need to be more careful, and they would need to look into this other type of flu shot.
Okay, now talking about the flu and colds, let's go over some of the myths.
There are a
I'm
lot
sure
of
you've
them.
heard a lot of them. The one myth is the stomach flu.
Right.
What is the stomach flu? Is it really the flu?
Right. I really like to address this question because there is a big misconception out there, in my opinion. The stomach flu is not the same as the flu that we're talking about right now. The stomach flu is typically some other virus or sometimes a bacteria or parasite that gives you primarily symptoms of vomiting, diarrhea, stomach cramps. You may have a fever. The flu that we're talking about right now, influenza, is primarily a respiratory illness. So especially in adults, it's going to cause those symptoms we talked about before, the high fevers, cough, sore throat. In children, they may also have vomiting or stomach symptoms, but it's still primarily a respiratory infection.
So what is the, if you're at home and you've got some of these symptoms, what's the thing to look for to know that you have the flu or you just have a case of the stomach flu?
If your symptoms are primarily stomach related, so vomiting and diarrhea, it's not the flu that we're talking about. But if you've got the whole combination, the fevers, the sore throat, the cough, and maybe some upset stomach, it's possible that it's the flu.
Now, in terms of the vaccine, the other myth is, or one of the other myths is that I got the flu shot.
Right.
Now I've got the flu or I'm sick.
Exactly. Right.
Can this vaccine give you the flu?
It cannot give you the flu. It absolutely cannot give you the flu. So the flu shot is not a live vaccine. You're not getting a live virus. You can't get the flu from it. The nasal spray is actually a live vaccine, but it's weakened. So again, you still can't get the flu from the nasal spray version. What can happen is that you get an immune response, so that your body is sensing the vaccination, and you might get a little bit of a elevated temperature, body aches, feeling a little under the weather for up to 24 hours. And what I tell my patients is that's actually a good sign, because that means that your immune system is responding to the vaccine.
Now, are there any other myths out there that you've heard or seen in your office?
I guess the other one that I would address is that, well, I never get sick, I shouldn't get the flu shot. And what I say to that is it's not just about protecting yourself when you get the flu shot, it's protecting others around you. So we talked a little bit about that. You know, people who are around young children or sick people, they really need to get the flu shot more to protect those people around them.
Okay, we're going to take one more quick break and we'll come back and talk more flu and colds, and we'll talk prevention as we continue with Healthy Perspectives from St. John River District Hospital. Welcome back to Healthy Perspectives from St. John River District Hospital. I'm Brian Taylor, and today we're talking colds and flus with Dr. Suzanne Ross from our one of our family medicine experts from St. John River District Hospital. Dr. Ross, let's talk prevention. What are some of the tips that you have for people to help prevent getting colds, getting the flu? Obviously, the flu shot is the primary one.
Certainly, absolutely. The flu shot is the #1 step that we can all take to prevent the flu. Otherwise, you know, the flu is spread a lot like colds are. So by coughing, by respiratory droplets, and close contact with people. So unfortunately, during the winter months, we're inside a whole lot more and in close contact. You know, being sure if you are sick to cover your cough, good hygiene. If you think you might have the flu, you know, maybe you want to stay home and prevent your coworkers from getting sick as well. Obviously, it can be tough to avoid when it's out there, but exercising, getting good sleep, and good nutrition is certainly helpful for prevention of any illness.
Now let's talk about kids. As adults, we can wash our hands, and we're more you know, conscious of what we're doing. We've got little kids running around.
Yeah.
How do you manage them and try to keep them healthy?
It's more difficult for sure, or keeping the adults near them healthy, I guess. But, you know, teaching them early to cover their coughs or to use a tissue so that they're not spreading their germs as much. And similarly, you know, making sure they're getting good sleep and good nutrition and regular exercise. Those are good keys to prevention of the cold and flu.
Now, are there any other things that people need to know before we wrap things up here about colds, about flus, about the season that's about to hit us here very soon?
The other thing I would say, I suppose, you know, the flu season can last until May. It tends to peak in January or February. So even into November, December, January, it's not too late to get your flu shot. If you've been thinking about it and you're not sure, it's best to just go get it and make sure that you're staying healthy.
Okay, well, thank you very much, Dr. Ross, for all the
Thank you.
tips and the information on cold and flus. There are always a lot of things going on at St. John River District Hospital. Now we're going to take a quick look at the events calendar right here. Well, thanks for watching today. We appreciate all the tips on the cold and flu season from our expert, Dr. Suzanne Ross from St. John River District Hospital. Until next time, I'm Brian Taylor, and you've been watching Healthy Perspectives from St. John River District Hospital. See you later.